Oh. Hi, my name is Dr. Sean Liu. I'm an orthopedic surgeon specializing in sport injuries, and I work in the clinic OrthoSports. Today, we're going to be talking about cycling injuries from the perspective of a cyclist as well as a driver. Cycling is a sport whereby the athlete is traveling at actually a very fast speed. It can range anything between 20 kilometers per hour to sometimes in excess of 40 kilometers per hour. One of my patients was cycling. He was riding pretty fast in an aero bike. Aero bike meaning that he is in a position where he's actually leaned very, very far forward. His back is almost parallel to the ground, and he was going at a very high speed. There was actually a pothole in the ground which he couldn't see from afar. At that point in time, he was actually trying to put a water bottle. He was trying to pick up a water bottle when the front wheel entered that pothole, and then he was flung forward over the pothole. He landed on his right shoulder, resulting in a pretty bad injury to his right shoulder. He had a fracture of one of the bones in the shoulder girdle. It's called the coracoid process. That's where a lot of muscles actually take the anchor from. And he also injured the ligament that holds his clavicle, the collarbone, to the scapula. What's even more serious, he had a series of fractures of his ribs as well. So he fractured his ribs from the second rib all the way down to the eighth rib. And that fracture of the ribs was actually the more serious thing because it caused his lungs to collapse. And because his lung would collapse, he couldn't really breathe properly. He had to undergo a pretty urgent operation to expand the lung. Once that is done, then we had the ability to treat the less urgent but equally important problem of the shoulder injury, as well as the fracture in the area. Part of it are injuries which orthopedic doctors take care of, and there are certain parts which will also require other people to take care of as part of a team. Now, just a straightforward fracture involving the upper limb, for example, sometimes takes about 3 months for it to be able to be strong enough to have a reasonable amount of weight being put across that. So if they are looking at going back into an aerodynamic position where they are actually leaning very, very much forward and there's a lot of weight onto the arms, you should actually increase the loading of the upper limb slowly. So you don't go straight into a very aggressive aerodynamic stance, but you start from an upright position in a recreational manner. And then you slowly work forward to a sporty manner. But if you've got fracture plus other injuries to the lungs, it's got other injuries to any internal organs, then of course it is not as straightforward. Cycling is a terrific sport. I enjoy it very, very much. But with all sports, a lot of care is required so that everybody is safe. And I would like to just share with the drivers as well as the cyclists that the road is something which is shared. And if we show some consideration towards each other,
Don't forget to like, comment, and subscribe for your regular dose of Asian health information.